Okay, so now we would like to talk about, okay, other types of diabetes where they're different from type 1 and type 2. We get diabetes insipidus with another rare form of diabetes, but I would like to talk about two today. We'll talk about gestational diabetes, and then we'll talk about drug-induced diabetes. Gestational diabetes, now the diabetes where we say women where they pregnant, they get. You understand? Their level of glucose they high. This one they more common in the third trimester. You know, say belle they for 9 months. So the first 3 months they call them first trimester. Second 3 months they call them second trimester. The third trimester na the last 3 months where woman carry belle. So within that last 3 months, the level of glucose they a bit high. So now not be something where we say somebody supposed to fear too much, because they always usually correct himself. The reason for that be say, you know, we see the study I'm saying that because of maybe some pregnancy hormones, now they cause, you know, the insulin receptors to be insensitive at that time, we go come cause the level of glucose today higher. Understand? So take note of that. If your wife get belle and you check the level of glucose at that time, you just need to go hospital, may your doctor, physician, actually they monitor the situation, or your gynecologist, or your internal medicine specialist, any of them, may they monitor the condition to make sure, say, you know, go overboard. But usually, they go okay at the end of the day. Of course, some extremes day, but no fear, God day. All right, the next one now, drug-induced diabetes mellitus. Okay, now this drug-induced now, you get some medicine where would they take, where fit increase the level of glucose for your blood. Now, one of that medicine now, antibiotics. One of these days we will talk about these antibiotics, because it cause a lot of problem. Even be say it help us as well, oh, but it cause a lot of problem. So one of the group of antibiotics where we say anytime where we see drug-induced, you know, diabetes mellitus wey caused by antibiotics, we dey know say na im dey cause am na fluoroquinolones. Particularly one drug wey be say we don pinpoint like this, say this one dey always dey cause that thing na gatifloxacin. Gatifloxacin na one of that drug. So take note, anytime person take gatifloxacin, their tendencies, chance dey be say e go increase the blood glucose level. Another one wey we dey talk about, that one na the beta blockers. Beta blockers na those drugs where they help, they decrease anything where they happen to heart rate. So those drugs where they talk LOL for the end, you know, propranolol, atenolol, metoprolol, testatolol, analolol, all of the lol. Now them, they increase, you know, the blood glucose level, which will lead to hyperglycemia. So we get a long list of other medicines where they cause am. But you see these drugs, them, because this one they more frequent where people they take. So make you they more careful when you they take them, because you know some people they take this one when they get, you know, increase in heart rate and all those things. So it they increase glucose level. So take note. So now quickly we'll talk about how to diagnose this condition. So we have various methods where they carry to diagnose this method. One of these methods where they diagnose, we could talk about the first one, which is fasting glucose method. Fasting glucose. Now this one means say the person no go take any food for at least 8 hours before this test. Okay, sometimes they say 6 to 8 hours, but 8 hours before this test. Okay, and then you go come check the person level of glucose with the blood. Now, if the level of glucose, I know we'll talk about pre-diabetes, I will talk about diabetes. If the level of glucose they greater than 126 milligram per DL, 126 milligram per DL, you know, you fit talk say this person get diabetes. They very important. Now the next one, apart from fasting glucose, with this one na random glucose test. Random. So if you check them anytime, you know me, whether the person eat or the person no eat, or if you check them. That one, if the glucose level for this person they greater than 200 milligram per DL, boom, this person get diabetes. diabetes mellitus. Okay? Now, the next thing I say, we dey do the one we call oral glucose test. So you go give this person glucose, then you go measure am, between intervals from time to time. Usually 2 hours between them, you go measure am. Now, if that person again get more than 200 milligram per dl, you go know say this person get diabetes mellitus. Now, the next one we say, that one they call am glycated hemoglobin. You know say when this glucose don full inside the blood, you understand, you go come try to attach to some proteins. This time now, you go come attach to the hemoglobin wey dey for, red blood cell wey dey inside red blood, go attach to am. Boom, na im you come call am glycated hemoglobin. So we go come check the amount of hemoglobin wey glucose don attach to. You go come check am. So when you check am, the amount of hemoglobin wey glucose don dey attached to, if e pass 6.5%, you go just know say, this person don get diabetes mellitus. Now, another test you fit do apart from all this one na say you go check C-peptide. Now, C-peptide dey check for actually the byproduct of insulin. Okay? Now, if the byproduct of insulin dey low or absent, you go know say insulin no dey, and you know say insulin no dey produce. So if insulin no dey or insulin no dey produce and the byproduct no dey, it means say the person get diabetes mellitus. So e dey very good make as you go hospital, your practitioner, your doctor or your lab consultant go check all these things. Then go come verify, know whether you get diabetes or not. Okay? You no fit just check am by yourself. Make sure say you go hospital, make them check am. E dey very, very important. Now, I wan talk one small thing wey researchers dey go through now, wey dem dey check now. People wey get blood group A or B, then dey more prone to getting type 2 diabetes mellitus. This one according to standard research wey don go on. You understand? People wey get blood group A or group B, dey more prone to getting type 2 diabetes mellitus. This one, they been conduct am for France with more than 8,500 women, and they find out say those wey get blood group A and B, dey more prone to getting diabetes mellitus. Now, this one no good. I get as I dey feel about this one. It no make sense. Say children wey dey premature, children wey dem born, less than 37 weeks, will be the normal period of gestation period. Then they at risk as well. They find out say 21% of children wey dey premature get chances to get type 1 diabetes mellitus, and then 26% of children wey dey premature, get likelihood or chance to get type 2 diabetes mellitus. So, premature babies now also another set of people who we need to look out for. No be them cause them. We pray say nobody will get those kind of circumstances. But in any case, where it happen, God will still help us, to prevent and make it happen. I want to make you know, say, might clear this doubt. If say your family member get them, it don't mean say you must get them. It means say you just get a little bit of higher chance, say make you get them. It means say your own, the chances say you go get them, they higher than the other person. But it don't mean say you must get them. So no think say if your papa or your mama or any of your brother or sister get them, you must get them or your children must get them. Remove them from your mind. Pray about them, make you not get them. But check yourself. So if you get them, you feel work on them early enough. The earlier, the better. All right. So the next slide will be the last slide. We'll come talk about how to treat, this diabetes mellitus, be it type 1 or type 2. Okay. Talk about how to treat them, and we'll talk about what will be other complications we know they good at all for the ear or the eye to hear about this diabetes mellitus, and why you and me must prevent ourselves and our people where they around us, our community must talk to them, make them for prevent the level of people we get die or we get problem from diabetes mellitus. I will see you for the next slide. Thank you.